Hi, my name is Debbie, and this vlog is about the speech that President Obama gave this past Wednesday evening about healthcare reform. The speech he made to the nation before a joint session of Congress. He made a very eloquent case for why the American healthcare system needs to be reformed. No doubt about that, and I agree with him. With his arguments. However, I think the majority of the people tuning into that speech understand that our healthcare system is a disaster. And what we were looking for was the substance. What does Barack Obama believe healthcare reform should be? What direction is he going to lead and try to push it in? And while the speech was very pretty, I think ultimately the content of it was very troubling, because the president was basically selling a mandated private insurance, government-mandated private insurance program, where everyone's required to have private health care insurance. And he dismissed one of the most crucial aspects that people want in the program, which would be a public option, as to a mere sliver that would cover only 5% of the population and would not be available to people who could get employer health insurance, even if that coverage was terrible. He basically was talking about making everyone buy this product from the private insurance companies. The people who have brought the healthcare system to its knees is going to be the system that we're all going to be forced into. He said something also very interesting. He said to progressives specifically, which I thought was kind of odd given that nearly 80% of the American people support a public option, which is just a government insurance program such as Medicare that would be an alternative to enrollment in a private insurance plan. He said that the public option was only a means to an end. And he also left the door wide open for alternatives. But I thought it was interesting he said it was a means to an end, because really what purpose has the public option served over these past few months? Originally, the public option was put out there as kind of a compromise and appeasement to people who really wanted a single-payer system. People who say the insurance companies take profit, they take exorbitant amounts in CEO salaries, they don't do this job as efficiently as the government has shown it can do through the Medicare example. They're about 100% more expensive in administrative costs. So let's just get rid of the private insurance companies, because we don't need them. And we can take that money and we can use it to cover everybody. Everybody can have full coverage healthcare insurance. And that's what a lot of people want. It's really been interesting to watch the Democrats go on about how we have to make sure this is fair and balanced for the fair and level playing field, rather, for the healthcare industry. Got to make sure that their profits are, they can compete. The American people hate the healthcare insurance companies, and we don't really care about their profit. What we care about is getting healthcare coverage for everybody. But it was interesting, because when I thought about the comment from the president saying that it was only a means to an end, the public option has been a means to an end, because it basically cut off dialogue, the central dialogue, which should have been part of this healthcare debate, which is this: should human health be a commodity? Should it be something that we allowed to be traded on Wall Street? There's no other country in the world, no industrialized country in the world, that allows insurance companies to make a profit off human health. But the United States does. And instead of having a discussion about the behemoth in the room, the insurance companies, and how much money they gobble up and take, we have had no debate. We haven't even talked about it. The time is now to talk about it. This health care legislation isn't written and it isn't done. And I think it is shameful that Barack Obama and the Democrats have allowed the healthcare industry to purchase them and to write and dictate this legislation and the debate. $375 million has been spent, the most ever spent on any kind of reform. The health insurance companies want this legislation. Don't be fooled. They are chomping at the bit for millions of new customers mandated to purchase their product. The program that Barack Obama proposed will not provide universal coverage. It will not provide equal coverage. Not everybody will be able to afford to purchase a program for full coverage. Many will be forced into catastrophic coverage. It's not a good plan because you can't do real healthcare reform without addressing the leeching of healthcare dollars by the health insurance companies. And Obama was right. The public option was a means to an end. It was a means to divert attention away from this discussion, to hold some kind of change out there, to keep people from really engaging in the true debate and diffuse a movement around single payer. It was a means to an end and it served its purpose. Now, I'm not saying that I wouldn't support a strong public option. I would support a strong public option. A strong public option being something that's available to every single American, not just 5% of the population who would be enrolled, and you could choose it whether your employer offered private insurance or not. Make it so that a public option is large enough to actually compete with the private insurance companies and bring down costs. That's what the public option was supposed to be all along, but it's been reduced and diminished into nothingness. So what we are left with is mandated private insurance. We have a fight on our hands, people. We have a big fight on our hands because this issue is too important to let the corporate leeches from Big Pharma and the big insurance companies to write the legislation for our health. We need to join together and we need to say, no, we're not going to allow these companies to dictate the legislation. We gave a mandate to the Democrats this past November for real change, not this. So in my next video, I will outline some of the actions that we can take and the things that we need to do to fight back, to push back, and to try to get real health care reform passed. The fight is not over. The legislation is not written. But we need to start talking to each other and we need to start making a plan because we have wasted months waiting to see what this president's going to do, waiting to see what they'll give us. We have to dictate what we will accept and we have to pressure our representatives. So I will outline that in my next video about what we need to do. But in the meantime, you need to make a personal commitment to fight for real healthcare reform.